It's been known I have cancer for a few years now, but I was certainly not in a bad state at the end of last year. So I came out to Singapore in early January, and then suddenly I was hit with something called lymphedema. And we discussed the fact that there was definitely no cure for me anyway. Palliative care is assessing the patient's condition and delivering medical treatment that is appropriate without looking for additional processes, additional techniques, additional intervention. It is purely a reactive process to what has already been established. And that is very, very clear. Where you are is exactly how you will stay until the end of your life. I think within an hour it felt like home. I came into this extraordinarily beautiful room and I was greeted by about 20 people, members of staff, volunteers and patients here, and I suddenly started feeling quite a lot better. And the doctors that then came to see me were talking very specifically about palliative care, and those discussions were certainly comforting to me, because I then had a very good view of what was being offered and how it was being offered and what we would do going forward. An average day here is remarkably well structured, and it's what you might expect from a mix between a reasonable hotel and your own home. No one is running around shouting at you and making you do anything. It's at your own pace. And then the day tends to be spread out how you choose it. I go for therapy sessions that involve some exercise. We have music therapy, so I do some guitar playing. We have art therapy. And the great thing about the hospice is that the public areas are much bigger than the private areas. So once you get outside your room, you're in a large area where you can't help but meet other people. It's a little bit of the curative process, because when you're talking to people in a similar position, we share a lot, and that makes you feel a little more comfortable. No one was talking through the big questions of how long would I be here. You're actually finally admitting to yourself that the end of your life is in sight. And that's quite important. And that's quite a big hurdle to overcome. And for many people, it's a hurdle that's perhaps a bit too big for them to deal with on their own. I mean, it's something we discuss, and there are very good teams here who talk about how you're going to deal with the end of your life and the practicalities. And the practicalities are quite significant. Well, that's something that we've put in place already. They clearly have very well set out guidelines, and so we have a process for what happens with my physical remains when I die, what happens with my possessions. In many ways, I've overcome my personal issues about facing the end of life, but my friends and family haven't. And the hospice has been of inestimable assistance in doing that. So in fact, they have extended their involvement to the people who I care about to make sure that they are doing the right things. But comfortable is the heart of hospice care. And I would say that Assisi, time and time again, has excelled in making me feel comfortable.